Child Advocates was founded in 1984 to provide a voice for abused and neglected children. Children placed in foster care face a scary and uncertain future. After being uprooted from the only home they've ever known, they're sent to live with strangers and attend a school where nobody knows their name. Adults rotate in and out of their lives, making decisions without their input. The process often repeats itself as they move from foster home to foster home. For many children, a child advocate's volunteer is the one constant adult in their lives. The volunteer talks to everyone involved in the child's life to determine what's in the child's best interest. The volunteer reports these findings to the judge, who uses that information to decide where the child should live on a permanent basis. Child Advocate's primary goal is to break the cycle of violence and neglect for every child we serve. Many of the families we encounter have histories of abuse stretching back for generations. Whenever possible, our advocates work with the children's parents to help them access the services they need to stabilize their lives and improve their parenting skills so the family can be reunited. When reunification isn't appropriate, our advocates help find relatives or adoptive parents who can provide loving, safe, and stable homes. Our vision is to provide this focused intervention for every abused and neglected child in Harris County who needs our help. Our challenge is to find the volunteers, resources, commitment, and compassion that will get us there. We've been successful because we've leveraged our position as Harris County's only court-appointed Special Advocates program. Child Advocates provides a unique, unduplicated service using volunteers to serve as guardians ad litem for abused and neglected children. Our volunteers are specially trained to know how to understand the needs of these children and then advocate for them in the court system. Studies show that children with a court-appointed advocate are less likely to spend time in long-term foster care or re-enter the system after leaving it. They do better in school, are able to work well with others, and demonstrate a positive attitude towards the future compared to children without an advocate. An additional benefit is that parents whose children have a child advocate are more likely to participate in counseling services, complete psychiatric evaluations, and seek drug and alcohol counseling. Child Advocates is a leader in applying volunteer manpower to ensure that abused and neglected children have someone designated to speak on their behalf. We're especially skilled at training people with no past experience with the child welfare system to effectively navigate this complex bureaucracy. After completing 30 hours of training and passing a background check, each volunteer is paired with a professional social worker who supervises no more than 24 volunteers at a time. This allows each volunteer to focus on one case at a time while receiving guidance and advice from an expert. Each year, our advocate volunteers spend more than 65,000 hours serving abused and neglected children. That equals the time worked by more than 30 full-time employees. Child Advocates is also effective because we offer an outstanding return on investment for society as a whole. By reducing long-term foster care placements, subsequent victimization, and re-entry into the child welfare system, Child Advocates substantially reduces foster care costs in Harris County. Additionally, when we're able to place children in permanent homes, their chances of becoming loving parents and productive members of their communities greatly improves. Every year, we strive to serve more children with more volunteers than we did the year before. We've met this goal each of the past several years. In fact, we've served 2,088 children in 2011, a 3% increase over the year before, and a 25% increase when compared with a decade ago. Plus, the number of volunteers we supervise has grown by 60% to just over 750 in the past 10 years. We conducted a multi-year longitudinal study in conjunction with the Hogg Foundation for Mental Health and the University of Houston Psychology Department. These results confirmed that our advocates have a profound impact on the lives of the children they serve. The study revealed that children who have a court-appointed advocate have greater self-esteem, can control deviant behavior, have a positive attitude toward the future, value achievement, and work well with others. Additionally, these children had fewer home placement changes and were less likely to re-enter the foster care system once they found the right home. Child Advocates plays a unique role in an abused or neglected child's case. In Texas, each child is assigned a child welfare caseworker and a court-appointed attorney. Our volunteers work closely with these professionals, but aren't required to agree with them. Instead, they provide the judge with an independent assessment of what they believe would be in the child's best interest. Because our advocates are independent volunteers, they often can earn the trust of a child's biological family more quickly than a caseworker or attorney. This allows them to obtain vital information and to keep everyone involved in the child's life informed as the case progresses. Child Advocates is the largest of 69 CASA programs in Texas. Plus, we're the largest volunteer-driven CASA program out of more than 1,000 nationwide. Many people don't know that each local CASA program is a completely independent 501c3 organization. The role of the state and national CASA associations is to provide technical support, assist with legislative outreach, and facilitate the sharing of best practices with the other chapters. Despite the economic downturn that began in 2008, we've served more children with more volunteers each year for the past several years. We've also trained more than 1,000 new court-appointed volunteers over the same time span. And we're very proud we were named Houston's Best Charity by the Houston Press in 2010. However, our most significant accomplishments involve children like Chastity, who entered foster care at the age of 13. Her crack-addicted mother abandoned her and her 10-year-old sister after selling their air conditioner, their stereo, and their older brother's shoes to buy drugs. Their brother begged for money so that the children could eat. Chastity's advocate, Smitty, persuaded her child welfare caseworker to expedite a home study so the children could move in with their grandmother. She also made sure both girls got the counseling they needed to heal emotionally from the trauma of neglect. Smitty also helped Chastity's grandmother navigate the system so she could ultimately adopt her granddaughters. Chastity graduated from high school in 2011 and is now attending college in Austin. Our primary challenge is managing our growth so we can serve more children without compromising the quality of the advocacy provided. Because we're the nation's largest volunteer-driven CASA program, there are no models available for comparison. We're continually working to balance our need for more volunteers against our infrastructure and staffing limitations. Volunteers are often eager to take a case as quickly as possible. However, increasing caseloads for our social workers has contributed to staff turnover and reduced the time available to support each advocate. Increasing our staff size would be a solution, but we won't hire more employees unless we have secured enough funding to support them on a long-term basis. It can also be challenging to find a balance between available volunteers and the stream of case appointments from judges. We generally ask judges to appoint us to the most complex cases on their dockets. Occasionally, we have more volunteers than appointments, so we must ask the judges for more cases to keep our volunteers engaged in the program. However, that often puts us at a risk of having to turn down appointments from the judges later because we're at capacity. Although Child Advocates has established financial independence from any single funding source, decisions by individual grantors can affect the number of children we're able to serve in any given year. It costs us approximately $1,700 to provide a court-appointed advocate for one child for 1 year. Additional resources would allow us to take more steps toward our goal of providing an advocate for every Harris County child who needs one. Child Advocates primarily serves children who've recently been removed from their homes and placed in foster care. However, nearly half of the children in protective custody in Harris County are in long-term foster care because the state has been unable to reunite them with their parents or find a suitable relative placement or adoptive home. Until now, Child Advocates has focused its limited resources on serving children in temporary foster care in an effort to prevent them from getting stuck in the system for years. Several judges have asked us to consider advocating for children in long-term foster care. Because of these requests, we've initiated a pilot project to study how best to serve these children. The results of this pilot project will help us decide whether and how to permanently expand our advocacy to this population of children.